Welcome to the Fascia-Informed Therapist, the essential podcast for occupational therapy professionals looking to deepen their understanding of fascia's pivotal role in therapy and health. I'm your host, Amy Mayer, an experienced occupational therapist, practice owner, and dedicated educator. Here we'll dive into the fascinating world of fascia, exploring its significance in the human body and its critical influence on occupational therapy practice. Each episode will bring you cutting-edge insights, expert interviews, and practical strategies to help you confidently integrate the science of fascia into your therapeutic approach. Whether you're a seasoned practitioner or just starting out, our goal is to equip you with high-quality, evidence-based, and fascia-informed continuing education opportunities that will enhance your skills and benefit your clients. So join us as we unravel the complexities of fascia and transform the way you practice occupational therapy. All health and wellness practitioners are welcome. Let's learn, grow, and evolve together. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist. Today, I'd like to talk a little bit about what we're doing this September. This is 2024. I have no idea how long this podcast will run, but given the amount of information we have about fascia now, it could go on for a long time, and I suspect we'll continue to learn a lot more as time rolls on, especially information that's going to be relevant to our practice as occupational therapy practitioners and, of course, all our related professions. We can all use this information. So what are we doing in September? Caitlin and I are going to be traveling a bit in September, which we love to do. We will be going to Manhattan, Kansas, and talking at the Kansas Occupational Therapy Association conference. And then the next weekend we'll be headed to Granby, Colorado to talk at the Colorado OT Association conference. Both conferences, the topic will be about posture. That is my jam. That posture is something that is so relevant to fascia and fascia science, and it's so relevant to our practice. Posture is something that we do think about as occupational therapy practitioners. We think about it in the context of wheelchair positioning. We think about it in the context of ergonomics, but I don't know that we really pay enough attention to it in the context of everyday occupations. We do if it's really obvious that it's not good, but we don't pay enough attention to the details, and there's a lot of details out there. So if you are in the area, I think you can probably still sign up for both conferences. I'm not exactly sure about that, but you can get basically our entire posture course for, well, at least we have more time at the Kansas conference. So you'll get a whole heck of a lot. Almost our full posture course will be in that presentation. We don't have quite as much time at the Colorado conference, and it's a little bit different format. They're doing something really creative this year and really focusing hardcore on everything in the context of occupation. So it's going to be a twist on our course. So if you can make it, I think it'll be fun. I've done the posture course for the Iowa OT Association, for Nebraska, doing one for a private company this fall in November, and have done it for a couple other private companies as well. So it's a super, super fun and super applicable. Everybody learns so much. We do touch a little bit on posture in the 7-hour course that I teach out of my office too. Kind of more of a whet your appetite, get the basics down, but everybody learns so much about their own posture and then learn how to translate that to their clients. So if you can make it, great. If you can't, then you might want to check out our posture course. You can go through it a little more slowly, and you can really learn how to, you can absorb the material better. The course is designed so that you assess your own posture and then you turn around and you start assessing other people to get the skills and the flow down. But you also get a lot of the science that connects posture with health and function. And it's absolutely connected to both. And when you start to learn those little bits of science, then you can share that in a way that you're with your clients in a way that they can digest it. And it really makes a difference on how much they adopt what you're trying to sell them, what you're trying to convince them of that will help them. And then when you put that into the what you want them to change about their posture or what you think will be helpful for them in terms of their health and function, and if you can layer that into their daily occupations, which we're going to do anyway, then it doesn't take them any extra time to really work on that. So they can get a lot of positive results with just a little bit of effort. Now, there are lots of people out there that still believe that posture is not an important thing to consider in your overall health. And I know there are people out there that will argue with me, but I think when you learn the science of fascia, you will change your mind. And I'll give you one quick example. When I want to learn about a topic, I get my hands on all the books and resources I can. And a couple years ago, we were just having this massive influx of clients with TMJ issues. And I pulled a couple books off of Amazon and started reading them. And one of them literally said that people are going to try and posture shame you and tell you that your posture is why you have TMD. And I was like, what? And this person that wrote it was a professional, someone in the rehab professions. And I was like, wow, that doesn't make any sense to me at all, because you adopt forward head posture. That changes the shape of your shoulders, your neck, and consequently your jaw. And we know that when you lose or change the angle of your ankles, for instance, then that changes the requirement of every other joint up and down the chain, right? So why wouldn't that be the same for your jaw? That's just one example of where posture can be extremely important in helping somebody heal. So we'll wrap it up there. I think that's all I'm going to say today. We're going to keep it super short. Okay. All right. Everybody have a great day. And if you are coming to either Kansas or Colorado, please make sure and say hello. We hit 500 downloads last week, and that just warms my heart tremendously. So thank you to all of you who are listening, but come say hi. And if you can't get there, then maybe check out the posture course. Oh, one more thing. We do also offer just the assessment that you can purchase. If you don't want to buy the whole course and learn all the science behind it and learn all the correctives that you can teach people to improve their posture, if you just want the assessment that we created so you can learn the assessment points, we do offer that separately from the course. So if you go to Fascia-Informed.com, and that will take you to our course library, that is a digital download, and you can check that out. So that is a much smaller investment, and you might decide once you look at that maybe you do want the rest of the course, and we'll give you a discount to get in there. So that is it. Have a wonderful day, and I will talk to you next time. Thank you for tuning in to the Fascia-Informed Therapist. It's been a pleasure sharing insights and strategies to help you integrate fascia science into your practice. I'm Amy Mayer, and I hope today's episode has inspired you to explore further and take your therapeutic skills to the next level. Remember, we're committed to creating and providing top-notch, evidence-based, fascia-informed continuing education that empowers you as an occupational therapy practitioner. Stay connected with us for more enriching content, and don't forget to check out our online courses to deepen your expertise. Until next time, keep expanding your knowledge, refining your skills, and confidently applying the science of fascia to your practice. Here's to advancing together in health and wellness.